Hello everyone, I'm Dr. Christine. Welcome to my seminar Acne and Rosacea. And today we are talking about pimples, bumps, pustules, whatever you want to call it, zits that can occur in your face and be very challenging. And as a former dermatologist, I'm happy to talk to you about it. Now, who I am? I'm a German-trained and board-certified conventional as well as a naturopathic physician, dermatologist, allergist, phlebologist, founder of the Ultimate Performance Health Coaching Academy and the International Society for Ultimate Health Coaching. I'm an author, speaker, radio host, teacher, and by choice an ultimate health coach. I'm now living and working out of Nova Scotia, Canada. What you will learn today, and let me take my picture away so you can see what I'm saying. You will learn about the differences between acne and rosacea. They are often confused, and some people call rosacea acne rosacea, but it's really two different entities. Now, what's the cause of acne and rosacea? They're different ones. And what else could it be? And are there any complications? We often dismiss it as something, oh well, it's just in your face, it's just cosmetic. No, it isn't. And you'll learn about that. There's conventional treatment options, and there's natural skincare that you should use for acne-prone skin. And I'll talk about how to heal acne and rosacea from the inside out in a natural way. Now, this is a little picture of the skin that shows how complex it really is. And when I go in here with my little red marker, you can see those are the free nerve endings. They transmit pain and itch. And there's the hair follicle here. This is a hair. And the nerve endings are in the hair. There's little muscles. And there's sweat glands, sebaceous glands, and blood vessels, and nerves and blood vessels, all kinds of different organelles that all have their own different function. Many people think acne is or rosacea is a dysfunction of the sebaceous or sweat glands. It's not that easy. Now, what are the difference between blackheads and pimples? This is a schematic picture, and you see here a hair, and where the hair goes in the skin, it's called a hair follicle. And a healthy pore is just normal skin with the hair sticking out. The top layer, the dermis, then there is the epidermis, and here are sebaceous glands, and the epidermis is moistured by the sebaceous glands. Now, what happens if the pore gets clogged in any way? And it's often, we get into the causes later, bacteria can spread within sebaceous glands. Now, then you have a blackhead, and those are enlarged pores because you can see the sebum sticking out of the skin, and bacteria turn it black. It's by nature, it's white. So the whiteheads are normal sebum, and after a while it turns black and becomes a blackhead. Now, when the bacteria spread here, it gets infected, especially if you squeeze or push on it or scratch it. Who doesn't pick? And it gets swollen and sore, which we call a pustule. A papule is just a red little pimple, and a pustule is one that has a yellow head and contains pus. Now, the difference between acne and rosacea. Acne is more looking like this, rosacea is more looking like this, and there's other differences, and I want to get a little bit more into the differences because we often think acne is more for juveniles and rosacea is more for adults, and there's some truth with it. Now, acne has whiteheads and blackheads, pimples, pustules, as we said, the red ones, and the pustules are the one with the yellow top, and can even have cysts, which are little abscesses or bigger abscesses under the skin. It mostly occurs as a teen because of the hormonal changes, but it can persist until adulthood. But there's no telangiectasias, which are widened blood vessels, those little spider veins in your face. They are not a part of acne. There's no excessive redness of the whole skin and no excessive flushing. Whereas in rosacea, you have no blackheads or whiteheads. That is a very important distinguishing. And there's redness of the face and easy flushing. When you eat something spicy, you get upset, you get red over your face, and the little blood vessels can enlarge and cause something like that looks like spider veins in your face. And it can also be pimples, and the pimples can be infected to pustule. Usually rosacea starts later, in their 20s, 30s, or even later. So there is some truth to it that acne is more a teen disease, but that doesn't make it harmless. Now, what are the causes of acne? Anybody that has a teenager with acne know that hormonal imbalances and changes can cause acne, especially if there's too much androgen hormones, which are the male sex hormones. For example, there's a polycystic ovary syndrome, and women that suffer from that have too much male hormones, often have acne, have problems with their period, and also have too many hair in their face. Now, many women experience some acne before their period, perimenstrual, PMS acne, and of course the puberty is the classical time for acne to be found. Often people forget that stress can cause acne. Friction, for example, a rubbing helmet, can cause acne. Diet can cause acne. If you have too many of the unhealthy type of saturated fats. Certain toxins and medications can cause acne. Infections and the disturbed skin microbiome can cause acne. And unsuitable, poor clogging skincare can cause acne, as well as smoking and indoor and outdoor pollution. There's many causes that have to be considered when somebody has pimples in the face. Now, rosacea, the causes are a little bit different because there's definitely a genetic or hereditary disposition. Often unsuitable skincare can cause rosacea. Persistent use of steroid creams, cortisone creams, cause not only enlarged blood vessels in your face, which leads to heavy flushing, but can also cause pimples that respond to cortisone and make you want to apply it over and over and over again. But it makes it worse. The more you use it, the worse it gets, and it can take very long after you stop taking it to resolve. So don't even start with cortisone creams for rosacea if you can at all avoid it. Even hydrocortisone, which is sold over the counter, should not be used in the face for rosacea or perioral dermatitis unless you have a wedding the next day or something like that. Then climate exposure, prolonged exposure to sun, cold, heat and wind can trigger or cause rosacea. Same as diet. Diet doesn't really cause rosacea, but it can exacerbate or it can cause flushing. Certain spices, certain foods can cause you to flush, and certain vitamins like niacin. Then chemicals, whether external or internal, can cause rosacea. as can a general inflammation in the body and free radicals caused by the inflammation. Now, what are the complications? The complications are scarce, especially from squeezing and picking pimples, or worse, from cystic acne. It can be severe and permanently disfiguring. So if you're teen or you are a young man or woman and you have more than a few blackheads and pimples, especially when you feel the need to squeeze and pick them, and who doesn't, you need to be concerned and you have to treat it aggressively to avoid permanent disfigurement. Now, rosacea can also lead to a disfigurement, which is more like a swelling, and in the nose area it's called rhinophyma. It's often associated with drinking, but it doesn't really have much to do with drinking. Redness and pimples in the face can cause disfigurement for both diseases. Cystic acne can cause pain, and the healing of skin after picking or cystic acne and the drying out through medication can cause persistent itching. Now, the pimples in your face cause often low self-esteem, shyness, embarrassment, and shame, which often leads to social isolation or even real depression and suicidal thoughts. So please take especially severe acne seriously, especially if you notice any of these signs in your teen. Now, what else could it be? Is it always acne or rosacea? No, there's other skin conditions that can look similar. For example, seborrheic dermatitis, bromoderma, iododerma. Those are diseases that are caused by halogen elements, cutaneous sarcoidosis or milia. Then there's rare genetic disorders like tuberous sclerosis, where the signs start early in childhood. There's a photodermatitis, allergic or irritant contact dermatitis, or a drug reaction that can cause redness and pimples. There's autoimmune diseases, for example lupus or dermatomyositis, that can cause redness and flushing in your face. There's heart issues that can cause redness and flushing, like mitral valve incompetence. There's certain cancers, for example the carcinoid syndrome, which causes a flushing syndrome. And there's also infections that have to be treated differently, like impetigo, which is staphylococcal usually, and herpes, which is a virus, as well as toxic exposures. So there's a lot of conditions to consider. That's why it's always advisable, if you have pimples in your face or redness and flushing and you don't know what it is, see a dermatologist. Now, what's a conventional treatment? For external or from the outside, usually teens and older adults are given benzoyl peroxide or retinoids, or chemical peel, or antimicrobial agents like antibiotics, which are effective, but they have side effects. They can irritate the skin and they can cause resistance. People are told to avoid triggers. Now, that's hard to do if it's a certain spice, or if you have a heart condition, or if the triggers are stress for you and you just have a stressful job. Then conventional are anti-inflammatory agents, and don't use corticosteroids if you can at all in the face, if you can. Then rosacea, the widened blood vessels, once they are there, can be effectively treated by cosmetic laser surgery. Rosacea, the swellings can be helped a little bit by manual lymph drainage and sunscreen use. At least it doesn't get worse, hopefully. And of course, especially women want to cover up their blemishes. From the inside, conventionally are used antibiotics. Then there's tretinoin, the famous Accutane, which has many side effects but is very effective for cystic acne. And as I said, cystic acne has severe consequences and should be treated aggressively, even if it means for a while that you have to go on Accutane. In cases like that, even short-term steroids, cortisone, can be indicated to reduce the inflammation to prevent building of serious scars, but it should always be in the short term. Then there's immune modulatory treatments from the inside, and there's of course hormones. There's an anti-acne, anti-baby pill that can be quite effective. What can you do naturally from the outside? The principle should be choose something that is not known to cause many allergies. So choose skincare with no artificial fragrances or preservatives, no mineral oils or other toxins, no skin clogging base, which can mean too much fat or oil, for example petrolatum jelly or sometimes even lanolin. It has to be water soluble. But on the other hand, fat-free skincare can sometimes be too drying out, so that's quite important. Then cleanse gently, preferably with water only. It's hard sometimes. Many women choose to use cosmetics and they need to be removed with more than water. That dries the skin out and in the long run can make it worse, so use a very gentle hypoallergenic skin cream after you remove your makeup. Of course, it is good not to pick or squeeze pimples because it makes it worse, but we all done it at some point, we all will do it, so it's best to avoid the pimples and heal them before they get so big that you absolutely can't resist picking and squeezing them. Because the squeezing, what it does, it is just distributing the bacteria in your skin better. So if you have a blackhead and you want to remove blackheads, don't squeeze them. Take a steam head bath with chamomile, which is anti-inflammatory naturally, and when you have your head steam bath, after 10-15 minutes, just pull the skin apart instead of squeezing, and the blackheads will come out by themselves. Now what can you do to heal acne and rosacea from the inside and out with natural means? From the inside, there's more than you think you can do. It's important to heal your gut microbiome. So your gut bacteria with fermented foods, probiotics, bone broth, and there's more. It's important to eat a varied diet low in processed and junk food, because often sugars and unhealthy trans fats can exacerbate acne, especially on rosacea too, by influencing our hormones. And eat a diet high in vegetables and fruit, preferably organic of course. Find and avoid individual food triggers. So if you notice anytime you eat ice cream you get acne, maybe you should eat ice cream less often. It can help to use stress management or even psychotherapy. And there's natural anti-inflammatories that you can use from the inside and outside, and I myself have excellent results with rain seed nutrition. The sole internally is excellent and is just a harmless nutritional supplement. From the outside, what can you do? Natural anti-inflammatories. And there's black tea that is very soothing for inflamed and red skin. Chamomile tea, ideal if you want to do a head steam bath or even to use on the outside. And the way you do it is you take a thin cotton cloth or even cheesecloth and brew a really strong black tea or chamomile tea. Let it steep for at least 10-15 minutes, and then moisten the thin cotton or the cheesecloth with it and apply it to your skin. It should feel cold. The cold, together with the astringent effect of the black tea and chamomile tea, will slowly make it better. I've got good results in my clients with the rain soul from the outside too, especially overnight. You can try a natural chemical peel with vitamin C paste. You start slowly. It can irritate the skin because it's crystals. Start with 1 minute. If you don't have a reaction, start with 2. And it's anti-inflammatory and antimicrobial too. There's others natural antimicrobials, for example tea tree oil, grapeseed oil, frankincense oil, which is very important to use in a suitable carrier oil, and so it is not too concentrated. And if picking is a problem, maybe try using small skin-friendly band-aids for isolated pimples. Cover up only if you want to go out and absolutely need it with non-comedogenic, non-acne producing, not non-pimple producing cosmetics. Sparingly, just as much as you need to. And for heaven's sake, avoid over-the-counter and prescription steroid creams if you can at all avoid it. And if you're already using an over-the-counter cortisone cream for longer times, it is the only way to get rid of it is to go very slowly and reduce the exposure. Now, that's today's presentation. I thank you for being so patient and following me through. I balance science and nature to guide people back to health. Please like and share my Facebook page. It's Ask Doc Christine. Check out my website, DocChristine.com, and there's all kinds of helpful tips there. And please contact me with any questions that you may have. Thank you very much. Have a great day. Bye-bye.